Welcome to this special PCTV program where today Senator Louise Lucas, who represents Virginia's 18th Senatorial District, joins us. Welcome to the program.
Oh, thank you so much for having me, Dana. It's really a pleasure to be here. I just want to talk a little bit about Medicaid expansion. We're doing the town hall, as you know, and we're doing the one here in Portsmouth, and we've done them in other places all across the Hampton Roads area because we're trying to get people more aware of what Medicaid expansion can do for those individuals who are caught in the coverage gap. First of all, people are calling this Obamacare, and I just want to make sure for the record, everybody knows it. This is an aspect of the Affordable Care Act that allows states to either opt in or opt out of the Medicaid expansion. Now, the Medicaid expansion provision was put in to cover those individuals who are not able to afford insurance. And we believe that every individual ought to have some form of health insurance because people are literally dying because they don't have any health care coverage. In Virginia alone, we know 400 and up to 500,000 people who fall in the coverage gap, who either do not make enough money or who are the working poor and just can't afford to buy the insurance, or people who are not working at all, maybe be on some kind of assistance and don't have health care insurance. So what this does, it gives us an opportunity to cover those individuals who were left out. And in Virginia, we're looking at about 500,000 people. And what we need to also include in this information is the fact that once we start paying into it, it becomes self-sustaining. Now, for the first 2 years, we pay nothing. All of this is the federal government, money coming from the federal government. But of course, there are tax dollars. Each state in the United States, as of January 1st, was required to pay money into this pot. In Virginia, we are losing $5.5 million a day because we have not expanded Medicaid. We're paying our money into the pot, but we're not getting it back because we're not enrolled and providing that coverage to the individuals we serve here in the Commonwealth of Virginia.
Okay, so where are we right now?
We're 27 days away right now from having the Medicaid expansion approved by the members of the General Assembly. So the legislators are now in conference talking about what changes they might want to make so that we can all go forward together. But that compromise, I'm thinking, is going to probably take us the remainder of this time to get it done because the Medicaid expansion is attached to the budget. And so if we don't get Medicaid expansion passed, then we don't have a budget. And you know, in Virginia, we're required to have a balanced budget. And if we don't have a balanced budget, then there are a lot of areas across the state that will not get funded. It pretty much amounts to a governmental shutdown. And I was talking to, just the clerk of courts. She was telling me about how her staff would not get paid if we have if we're forced to have a shutdown because we don't include Medicaid expansion in our budget. So it's going to hurt an awful lot of people. Teachers won't get paid. Firefighters, some of our public safety people will not get paid. And so we're going to find ourselves in very dire straits by the end of June if we don't expand Medicaid.
Okay, so today we wanted to bring this information to our PCTV viewers. Wanted to let them know that this is not about a particular party. Can you address that and just...
Absolutely, because I have a fact sheet, and I will leave one with you so that you can peruse it at your convenience. And it makes no difference what area of the state you're looking at. In fact, a lot of the areas that are more red areas, that are more Republican supporters, or more Republican voters, those are some of the highest numbers of people who don't have insurance. And so it doesn't matter whether you're a Democrat or a Republican, all across this state, there are people who don't have any insurance. And as you will see as we go through this town hall meeting, you're going to see all these people who will come up and talk about how Medicaid expansion would impact their lives and how not having insurance would also serve as a disadvantage to them.
Right. Okay. Well, let's take a break now, and then we'll go to the town hall meeting that was held right here in the Portsmouth City Council Chamber.
Thank you so much for having me.
Thank you.
Enroll, we say, we want you to be okay. Enroll, we say, take care of people for goodness sake. There's a plan for every budget, so don't accept defeat. Now you can get covered and still
buy me treats.
You take care of your pets. Now it's their turn to take care of you. Visit getcoveredamerica.org to learn about your health insurance options.
God bless. Thank you, Madam Senator. Let us all look to heaven now for guidance. We trust, Lord, that as you've allowed us to come together here tonight, we all come together understanding, Lord, how important this gathering is. And as I stand here in prayer, my representation through this prayer and for all that would hear would be for kingdom purpose. Lord God, when we get to the point that we forget the least of those, then something is amiss. So I pray tonight for everyone that's here, and a special dispensation for Senator Lucas, who's had a tragedy befall her family. So all would join in that please on behalf of a public servant that's been dear to us for many years. All those who are here tonight, God, I ask you to bless them. Bless them in their hearts, that they may find words, those who speak, that are relevant to the issue of taking care of those who can't readily take care of themselves. It's in your name, Christ, that I ask your blessings would fall on this audience tonight and our esteemed leaders as well. If there's one here who would be dissonant, let their heart be melted to this cause. It's in your name, Christ Jesus, that I pray for all that are here. Amen.
Amen. Thank you, Reverend Hill. We are seated on this dais in seniority order, and so I would ask right now that Delegate Lionel Sproul, who is the senior-most person next to myself, would please lead us in a pledge of allegiance to the flag.
We all please stand.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We have a format that is very much similar to the town hall meeting that was held in the city of Chesapeake, and so we'll follow very closely to that format. At this time, I'd like for Senator Mamie Locke, who is the chair of General Laws, to give us an overview of where we are with Medicaid expansion at this point.
Good evening, everyone, and thank you so much for turning out in such a large number this evening. As indicated, my name is Mamie Locke, and I represent the 2nd Senate District, which covers portions of the cities of Hampton, Newport News, Portsmouth, and part of York County. In terms of and before I get started, Senator Lucas, I would like for everyone else up here, if they would introduce themselves, beginning with Delegate Hester.
You can. You might want to tell them what committees you serve on.
Hello, everyone, and thank you for coming. I am Delegate Dawn Hester in the 89th District in Norfolk, and I serve on appropriations and education.
Good evening. My name is Matthew James. I represent the 80th District, which includes parts of Portsmouth, Norfolk, Chesapeake, and Suffolk. I'm on House Finance, I'm on Commerce and Labor, and I'm also on Chesapeake Agriculture and Chesapeake Bay. Thank you. Glad to see you all here.
My name is Algie Howell. I represent the 90th District, which covers part of Virginia Beach and part of Norfolk. The committees that I serve on are as follows: HWI, which is Health, Welfare, and Institution, Rules, Privileges, and Election, and Appropriation. I'm delighted to be here with you tonight.
My name is Lonnie Ushbull Sr.
There's a switch that's on this side.
I'm from Chesapeake, but we didn't know how to do that. Good evening. Thank you. My name is Lonnie Ushbull Sr. From the city of Chesapeake. I represent the 77th House District, the city of Chesapeake and Suffolk. Committees I'm on county, cities, and towns, health, welfare institution, and Commerce and Labor.
Good evening. I'm Michael Kerner. I'm the Bon Secours CEO for Hampton Roads here, and thank you for allowing me to be here today.
I'm Gayleen Knoyton, President of Celebrate Healthcare, and we are an access, education, and advocacy company.
And I know most of you know that last week I celebrated my 30th year as an elected official, with 23 of those years being in the Senate of Virginia. I currently serve on Senate Finance, Education and Health, where I am the chair of the committee. I serve on Rules, Local Government, where I'm the former chair of the committee, and I also serve on Local Government. Did I say that? Yes. Okay. Rules. Senator Locke?
Okay, I chair the Committee on General Laws and Technology and also serve on Finance, Rules, Education and Health, and Local Government. Senator Lucas asked that I talk to you a little bit about where we are with the issue of Medicaid expansion. As you are aware, we are in a special session because we did not come to resolution on a budget during the regular session. So the governor called a special session at which time we would deal with the budget. We've been back to Richmond on a couple of occasions, but are currently in an impasse. In the initial Senate budget, there was a Medicaid expansion was included, but it was under the name of Marketplace Virginia, which would allow the market to determine how we would deal with closing the coverage gap. That failed to report. The governor introduced his own budget, which included Medicaid expansion under that name. That also failed to report, primarily because the House of Delegates refused to hear it. And the House of Delegates also indicated that the only budget that should be heard was the House's budget, and not the governor's and not the Senate's. The Senate has also passed a second budget, which went back to Marketplace Virginia, again allowing the private marketplace to determine how we would close the coverage gap. And that particular, and that's where we are now in terms of there is no budget because we have yet to agree on what that budget should entail. The discussion is primarily around trying to decouple the issue of Medicaid expansion of Marketplace Virginia from the budgetary process. And if we did that, then there would be no Medicaid expansion at all, because that is basically the sticking point. And while there are those who will tell you that we don't want to use federal dollars for Medicaid expansion, the House budget currently includes money from the Affordable Care Act. That was Medicaid expansion that included medical expenses. So to say that they did not want to include any kind of money from the Affordable Care Act is inaccurate, because their budget already includes money from ACA. So to not address this issue and to engage in any number of gimmicks, and many of their concerns have already been addressed by both the governor, by members of Senate Finance, and also by many of you out there, by the press, many of whom have come on board in support of the Senate's budget. And in terms of many businesses out there are in support of Medicaid expansion or Marketplace Virginia, whatever you want to call it. It all leads to the same thing, and that's closing the coverage gap for those 400,000 Virginians who are without health care. And these are not individuals, and one of the things you will hear is that, we don't want to have any more Medicaid, covering these people who don't want to work. Closing the coverage gap is for individuals who do work. These are the working poor, individuals who are too poor to afford health insurance. And many times they're working more than one job. So it's not as though you're talking about people, because individuals who don't work already get Medicaid. You know, so it isn't as though you're going to continue to cover individuals who are unemployed, because as I said, they already get Medicaid. So we're trying to close the gap of those individuals who are currently working but do not make enough money to pay for health insurance. And ladies and gentlemen, believe it or not, you're going to pay for it anyway.
That's right.
Because these individuals are going to end up in emergency rooms, sicker than they need to be, which is going to be more expensive, and that cost is going to go to you. In paying for in paying your insurance, you're also paying their insurance.
Thank you, Senator Locke, for that overview. And before that's a good segue into what we want Michael Kerner to talk about. But before I do that, I'd like to recognize the true leaders of this House, and I would like for you to stand. I see Mayor Wright, Vice Mayor Cherry. I see Councilwoman Marlene Randall. And with the lights in our eyes, we can't see very well, so are there other council members in the audience? I did see the three of you, and so I just want you all to join me in an applause for recognizing them and allowing us to use their seats. Thank you for allowing us to grace your chairs tonight. And so, Delegate James needs to make a statement before we let Dr. Kerner go into here.
I just wanted to make a point of clarification, not that it needed to be said, but none of the House members on this panel voted with the majority of the House. We all voted to support the position. Thank you.
And I guess with that, maybe in the spirit of full disclosure, I might need to say that those persons in the House who did not vote for Medicaid expansion were invited. And until just a few days ago, we thought a few of them might be coming. Now, Delegate Kenny Cooper Alexander did vote with us for Medicaid expansion, but you know, he's a mortician and duty calls. And so he could not be here with us tonight. But I want to recognize Cheryl. Cheryl is in the audience recognizing Delegate Joanna. He said he has a client this afternoon, Cheryl? Well, you know, and again, in the spirit of full disclosure, I need to also say that Delegate Joanna was the only Democrat in the House who voted against Medicaid expansion. So you all need to know that as well. So with that, Congressman Scott has a representative here. DeMontre Boone. Gonna have to check him out because his last name is the same as my maiden name, so we might be relatives. Thank you for being here. And Congressman Scott did indicate that he has a speaking engagement in Richmond and that he will be leaving Richmond, and barring any traffic that would take more than an hour and a half for him to get here, that he will be speaking at the end of this program. So now with that, I'd like to introduce Michael K. Kerner, who is the Chief Executive Officer of Bon Secours Hampton Roads. Michael joined Bon Secours Hampton Roads as the CEO in August of 2008 when Bon Secours Richmond merged with Bon Secours Hampton Roads to form Bon Secours Virginia. The merger made Bon Secours Virginia the state's fourth largest integrated health network. But what he's about to tell you is the situation that they're going to find themselves in should we not pass Medicaid expansion. Michael?
Thank you, Senator Lucas. As was noted, we are in support of the governor's plan and Senator Watkins' Marketplace Virginia proposal, and support the members of this group here tonight in working to gain the coverage that we need. We are, as you know, a faith-based organization, and our sisters who are our founders, or foundresses, have supported this work over the United States, not only in Virginia but other places too, because they see that there's a need for compassionate care, there's a need for this expansion so that people can receive the care that they should receive in the different, either not in a hospital alone. Our sisters came from, they were home care nurses as they started years ago, so they believe that a lot of the good care is provided out in the community and in the home. So they've been very supportive of this and have been since the first discussion around ACA, because they believe the Accountable Care Act, ACA, they believe that people should have access to care. And just so you know, we have in Portsmouth, you know, we have Maryview Hospital, and there's over 1,000 people that work at that hospital. And we invest in the community, even though we're not for profit. We pay payroll taxes and so forth, and we put $84 million back into the community. But that's not the big point of what we're here tonight for, but it does show that we have a commitment to this community and the commitment to Hampton Roads. But we do believe that the Medicare expansion needs to happen, and mainly because of the people we treat each day. Joe Otis is here. He's the CEO of Maryview Hospital. He can tell you stories of patients each day that come into our facility that haven't received care that they should have received. And when they do come into our hospital, they come in through the emergency department and they're deathly ill because they didn't have the ability to go to a doctor. They didn't feel that they could comfortably go and then get a bill in the mail or whatever that they were afraid of. But they were definitely afraid of getting that care until it was almost too late for them to come in. And when they do come into the hospital, they really do come in to die in a lot of cases because they haven't received the care that they deserve to receive. And so we're really talking about access to care. And if you look at the studies that are out there, it'll show that access to care is so important to people. And you know this from your own lives. If you are able to go to a physician and receive the care that you need early enough, then you can stave off things that might cause further problems for you, like a cancer or some other illness that you may see that you have. But if you're not going to the doctor on a regular basis, that can cause grave problems for you. So when we looked recently at some data out in the community about our communities in Hampton Roads, we can see across Virginia and in Hampton Roads, we ranked 26th across all the states in health. And the health factors that were looked at were things like obesity, diabetes, mental health or unhealthy days of mental status, cancer, and so forth. So when we look at those things, when they rank us in Virginia, you would think Virginia is a pretty progressive state, does pretty well overall. But when you look at us from a health standpoint, we rank, well below the half, or at about the half of the whole of the United States, with the ability of our citizens to receive care, but also for the ability of our citizens to feel good about how they are, what's their health really like. And that's a Robert Wood Johnson Foundation study that's been out there, and they do these studies every year, and they look at communities across the United States. And you can see one of the reasons is it's not all about the health care that's provided, but it is about access to health, and it's about access to physicians. It's about access to things like a healthy community to live in. It's being employed and so forth and so on. So there's a lot of factors that go into this Robert Wood Johnson study, but one of the major factors is are people, do they have access to the care that they need to stay healthy? And it's been pointed out already, it's very expensive for us in our community to treat people once they've gotten to the point where they're very sick. And they come in through the emergency rooms, and they come into the hospital at a point where we really can't do a whole lot for them. It would have been much more cost effective for everybody to have that care early on and to have it done in a primary care office versus in an emergency department, and versus in a hospital in an ICU, when maybe if care was provided earlier, those individuals would not end up in the hospital and as sick as they were when they do come in. We know, and it's already been pointed out, that we're sending $5 million a day to the federal government of tax dollars out of Virginia. That's money, $5 million a day, that all of us pay, we pay in taxes, that's going to the federal government that we're not going to see if we don't participate in the expansion of the Medicaid program. So we see that as we're already spending the money. People are concerned, I know, about the federal government being able to continue to support that, but the tax dollars are already going. All of us started to pay more taxes this year for the ACA plan, and so we're just really looking to take advantage of the funds we're already paying to the government to provide this expansion of service. We believe that it's critical to our mission. What we do each day and the charity care that we're able to provide is this expansion will be critical to being able to continue to do that into the future. And I know we've had, when the governor came, a number of our doctors told the governor, if we don't see this happen, we're going to see services close and we're going to see parts of the hospital potentially close. I don't want to cause any kind of unnecessary concern on the point of our employees from that standpoint, but we do know if we can't continue to do the things we do at the level that we do without some additional help through this expansion of Medicaid. Each of our hospitals are typically in areas of the city that we didn't move our hospitals out to the suburbs. We didn't move our hospitals to the better areas that pay better and that people have insurance and so forth. We're in the middle of Norfolk, in the middle of Portsmouth, and on the peninsula, so we tend to take care of a lot of disproportionate share of patients who don't have the ability to pay, and we want to continue to do that. That's part of our mission and part of our ministry to do that. But we do believe that, just in a nutshell, that this has to happen. You probably don't know that Medicaid today pays us less than our cost to take care of the patients. Now, you know, and I'll say it again, they pay us less than our cost to take care of the patients. So we're working very hard to reduce our costs, but to be able to do the work that we do, we don't think we can get our costs down below what Medicaid is actually paying us at this point. So the other point that was made, that we're all paying for this, the people who have insurance are subsidizing the people who don't have access to insurance and don't have access to coverage for their care. So that costs us all, again, other dollars that you don't see each day. And that's over and above the $5 million that we give to the federal government each day through our tax dollars. So again, the ability to provide that coverage, the ability to actually share in the cost of that is important, I think, overall. If you noted earlier, we talked about who supports this bill. The business community has supported the bill all along. The Chambers of Commerce across Virginia have supported this bill all along. So there is a tremendous amount of support in communities that maybe in the past we didn't see the concern as much, maybe, or we didn't see that the support for it. But this time around, people understand that it's costing the system significant dollars, not just in the fact that we're not getting reimbursed, but in the fact that people are not healthy, they're not taking care of themselves when they could be by receiving the primary care support that would allow them to have healthier lives. So I won't go on further with that, but that's really where we are. We do provide a lot of services to the community. We provided about $72 million at cost in charity care, and Centera does that too, and so does Chesapeake and so forth. Each of us provide a significant amount of charity care to the community, and we'll continue to do that as much as we can. But we do see, for those of you who don't know healthcare, we've had reductions in our reimbursement in a lot of different areas. Sequestration, disproportionate share is an area we used to receive some help for treating a disproportionate amount of Medicaid patients. We don't receive, or at least that's being reduced over the next 3 years, so we've seen a third of that go away. So we're seeing cuts in significant areas along the way, and one of the reasons we were able to do some of this before was we expected to receive some of the increased reimbursement through the Medicaid expansion, through being able to have more people covered under the plan. And so, again, we're going to have to continue to adjust and tighten our belts, which you'd expect. At the same time, we really do support this, as much for the dollars as much as for the ability for people to have access to care, to have a healthier community. And I'll stop there. Thank you.
Thank you. And I'm sure we're going to come back to you when the audience has formulated their questions for you. And at this point, if the technician has the appropriate information, we'll move to Dr. Lee, and then we'll go to Gayleen Norton. But before I do, I want to make sure she's got you up and running first. Okay. Dr. Jennifer Lee is an emergency physician appointed by Governor Terrence McCullough as Deputy Secretary of Health and Human Resources. In this role, Dr. Lee co-manages the day-to-day operation of 12 agencies within the Secretariat under the direction of Secretary Hazel, and advises the Secretary on a wide array of health policies. Prior to her appointment as Deputy Secretary, Dr. Lee served as Assistant Professor in the Department of Emergency Medicine and Health Policy at George Washington University. Dr. Lee was appointed to the Virginia Board of Medicine by Governor Tim Kaine and served from 2008 to 2011. She also served as a Health Policy Fellow for Senator Edward M. Kennedy on the U.S. Senate Health, Education, Labor, and Pension Commission. Dr. Lee completed her residency training in emergency medicine at Johns Hopkins, received her medical degree from Washington University School of Medicine, and a bachelor's degree in molecular, biophysical, and biochemistry from Yale University. Dr. Lee. She doesn't look old enough to have done all of that. I know you all think the same thing I think.
I know I look a little younger than I am. Thank you so much, Senator. Thank you very much, distinguished members of this panel, and guests, for taking the time out to pay attention to this very important issue. I can tell you, without a doubt that it is the number one thing that our administration, our governor, Secretary Hazel is focused on right now, because it is so important for the health of so many Virginians. And what I thought that I would do in just a few minutes is go into a little bit of detail about what we mean when we say the coverage gap, and what we're talking about when we say let's close that coverage gap. Because when you look at it, it really is hard to understand why there would be people who don't think we ought to do this. So I've brought some slides to go through, and just again would like to just quickly provide an overview, make sure that we all understand what we mean when we talk about the coverage gap. So we'll go to the next slide, please. Thank you. So I think it's always helpful to just start with the basic facts. And here you see just some basic numbers that are of our total population in Virginia, which is about 8.3 million. We do have over 1 million Virginians who are uninsured, who don't have health coverage. So that's a sizable number. And over 400,000 of the 1 million who are uninsured could potentially get insurance coverage if we close the gap. Let me go into a little more detail. Next slide. But first, you know, as the senator said, my background is I am an emergency physician, and as such, I've seen in my practice of almost 10 years working in the ER what happens when people don't get health coverage. And there is study after study that shows that their health really suffers. Here's just one quick slide that shows what happens. The blue bars are representative of those who are uninsured, and on the left it says those who postpone care due to cost, and you'll see the blue bars are those who are uninsured compared to the green bars, those who are insured. So more of the uninsured postpone getting the care they need because of the cost. They don't have a regular source of care. More of the uninsured do not fill prescriptions because of the cost, and have medical bills that had a major impact on their life. And in fact, those medical bills are the number one source of bankruptcy in this country. So next slide. When you think about that, and I think about my own experience treating patients in the ER who don't have insurance coverage, it's not hard to see why this is true. And again, study after study, literally hundreds of studies, have shown that those who are uninsured don't get screened for cancer, don't get the regular screenings they need for diabetes, for high blood pressure, for heart disease, and so then they're more likely to suffer the consequences of being diagnosed at a later stage of cancer and not having as good a chance of surviving and maintaining a healthy life with some of those chronic diseases. So in fact, this was Institute of Medicine study. It's pretty striking that even if you control for all the other factors and take all those other factors into account, not having insurance is a leading cause of death. So from a health standpoint, it's pretty clear why health insurance matters. And you'll see that lack of insurance causes as many deaths about as diabetes, and almost as many as stroke. So insurance coverage is important for health. And when people do not have insurance coverage, we know that, again, they postpone care until it gets to a crisis point, and then they often come to the emergency department, where we do take care of people in that point of crisis. But of course, the outcomes are not as good at that point, because the high blood pressure is out of control and they're having a stroke, or they're in a diabetic coma at that point. And then, as you can imagine, the costs are much higher, and the consequences for that person and their family are just much more dire. So who are Virginia's uninsured? The vast majority are part of working families. They have at least one, often multiple members of their family who are working. And the vast majority live in families who are low income, below 200% of poverty. What is 200% of the poverty line? That's about $23,000 for a single adult, or about $47,000 for a family of four. So most families, when we think of the uninsured, we think of the working poor. those who are working but are not making very much. Why are people uninsured? Well, most people who have insurance get it through their job, through their employer. If they don't, they might try and go and purchase insurance on their own. And before the Affordable Care Act, it was very difficult if you had an illness to get insurance on your own because you might get denied for coverage, or the premiums might be so high they're unaffordable. So then you would look to public programs. And if you're 65 or older, then you have Medicare. And if you're poor or low income, you're supposed to have Medicaid to help you. Studies show that people who don't have insurance, it's not that they don't want insurance, they really do want health insurance coverage. It's just that, again, it's not offered through their job or they're self-employed, and then they can't afford it or they can't get it otherwise. So in terms of public programs, again, we think of Medicare as being there for you when you're 65 or older, and Medicaid as being there for you if you're low income. But I just wanted to make sure that we understood the current situation with our Medicaid program in Virginia. In the next slide. Currently, in our Medicaid program, just being poor, just being low income is not enough to qualify you for Medicaid coverage. You also have to, in addition to having a low income, you also have to fit into certain categories. What are those categories? Well, you have to be either a child or a pregnant woman or a parent, or have dependents, or be blind, aged, or disabled. So you have to meet one of those categories, be a parent, pregnant, or a child, blind, aged, disabled, and low income in order to qualify for Medicaid. Who does that leave out? And that leaves out adults who don't have dependents, who aren't disabled, aren't pregnant. So a lot of single adults out there who are poor cannot get Medicaid coverage. Next slide. So this one it's a little bit hard to see, but this chart just shows the different categories of people and also what the income levels you have to be at are to currently get health coverage through our Medicaid program right now. So on the left, those bars on the left show children and pregnant women. And again, if you're a child or a pregnant woman and you're poor, you can get coverage through Medicaid. However, if you are a parent or have dependents, you could possibly get coverage through Medicaid. I said that was one of the categories where you could get it. However, the income cutoff for that category is very low. It's approximately 30% of the federal poverty line. So for a family of four, 30% of federal poverty would be about $8,000. So if you are over $8,000 in a family of four, you are making too much for Medicaid currently in our program right now.
That's the problem.
$8,000 for a family of four. That's where we're at right now. Now, it's pretty striking that that's our cutoff right now. It's very, very stingy, our current Medicaid program. If you are a childless adult, doesn't matter how poor you are, you could have zero income, you cannot qualify for Medicaid right now. That's how the Medicaid program is currently. So there are people who are left out. This gap that exists has been here for a while. What is the opportunity now is the chance to close the gap with federal dollars, and I'm going to explain a little bit more. So that's where we are. So again, this shows that the federal poverty guidelines, again, very low. Look at that for a family of four, 100%, 24,000. So 30% of that, 1/3 of that is our cutoff right now.
That's terrible.
It's very, very low. So again, who's left out? If you think about it, you have a working single mom, 2 kids, makes $10,000 a year, would never qualify for Medicaid. Adult who's not disabled, has no children, but only makes $5,000 a year, never qualify for Medicaid right now. Disabled adult who brings in $11,000 doesn't qualify for Medicaid right now. So then along came the Affordable Care Act. And however you feel about that, I'm just going to explain what it does, and it is the law right now. So the Affordable Care Act, really the primary goal of it was to provide insurance coverage for as many Americans as possible. And it did that through a number of means, but the key pieces here that affect us at this time are the marketplace and the Medicaid expansion. So the idea of the Affordable Care Act was it saw that there was variability across states and who was being covered. So the law says, well, it shouldn't matter whether you have a child or you don't have a child. If you're poor, let's have Medicaid cover you up to 138% of the poverty line. Just across the board, if you're poor, you should be covered. So we're going to have the states do that expansion of the Medicaid programs to cover everybody who is poor, regardless of their situation, of their family situation. And then for the rest, 100% of poverty to 400% of poverty, so a little higher income level, we're going to have subsidies to help you pay for your insurance premiums through the marketplace. So as you know, the marketplace enrollment just ended not too long ago. If you were able to qualify for subsidies 100% to 400%, then you could get some help getting insurance through the marketplace. So right now, so again, just to say that one more time, the Affordable Care Act, 0 to 138, it asked states to cover those folks who are 0 to 138% of poverty in their Medicaid programs. 100% to 400% would get help with their premiums through the marketplace. So then what happened, the Affordable Care Act was challenged, went all the way up to the Supreme Court, and the Supreme Court made a ruling that the Medicaid expansion was going to be optional. So not all states had to do that. The original law said that it was not optional, it would be required for all states. So this is why we're having this debate right now. Every state is having a debate about whether they want to expand their Medicaid programs or not. So how would the Affordable Care Act pay for all those people to come into the Medicaid programs? As you can imagine, there would be quite a few people all across the country who would be eligible for care in Medicaid. The federal government said that through the Affordable Care Act, the law said that when states expand, the federal government would pay for the people who would come into the Medicaid program as a result. And they would pay 100% of all those people who would get coverage from 2014 to 2016. And it would go down a little bit, but would never go below 90% for people 2020 and beyond, forever. So as you may know, our Medicaid program now is a state and federal partnership. Right now, for the people who currently get coverage in our Medicaid program, we pay half, 50%, and the federal government pays 50%. So for every dollar we spend, the federal government throws in $1. So this is a great deal because what the federal government is saying through the Affordable Care Act is that if you expand your coverage to those folks you haven't covered before, the big group being the childless adults, but also raising those limits for parents, the federal government will pay 100%. And beyond that, would pay 90% of the cost. So that's quite a bit of money, you would say, for the federal government to pay. And you also may have heard the Affordable Care Act does pay for itself. The Congressional Budget Office and many other reports have done analyses, independent, nonpartisan analyses that say that Affordable Care Act pays for itself. So how does it do that? Well, it's because through a number of means, through cutbacks in payments to hospitals, as you heard, that the hospitals are already feeling, and through some increase in taxes to the wealthy. Go through next slide. So again, reductions to some Medicare payments to hospitals, some of which are taking effect already. And next, increase in taxes for those at very high incomes. So the Affordable Care Act builds in the funding stream in order to pay for the expansion of care in Medicaid programs, which was intended to be all across the country. So all of those cuts and new fees or taxes meant to fund the Affordable Care Act have already begun to take effect at the beginning of this year. And we in Virginia, as you've heard, you may have heard this number, are paying into that $5 million on average every day since the beginning of this year. Those payments are required. We don't have a choice. They're mandated because this is federal law. And yet, we're not taking advantage of what that money was meant to do, which is it was really meant to cover a lot of people through the Medicaid program. It also goes to fund some of those subsidies, and we do have quite a few Virginians who are getting coverage through the marketplace now, but for the over 400,000 people who are low income who could benefit from Medicaid coverage, all paid for by the dollars that we're spending, we're not taking advantage of that right now. And that ends up being a lot of money, $2 billion every year and over $10 million over 5. And so this just is a graphic. So before you saw the blue bars showed who was covered in our Medicaid program now and who could be covered if we close the coverage gap. That bright red bar on the right, all those childless adults who don't have coverage right now at all in Medicaid, all the way up to under 38% of poverty could be covered, and we could cover many more low-income parents as well. So again, we are paying all of this money in now, and we're not getting the benefits back and those dollars back in terms of coverage for people through the Medicaid program. And even if you don't think that we should be supporting more health coverage for people who are working hard, trying to contribute in our community, even if you don't think that, being able to cover those people with these dollars will actually help save our state money, because then we can help save some dollars that we're using to support hospitals who provide a lot of the uncompensated care, and use that money for other things like education or transportation or infrastructure, and helping invest in businesses and jobs here in the state in other ways. So we're all paying for, both directly and indirectly, the fact that we don't have real good health care coverage right now for many Virginians. Next slide. And just so you see what other states are doing, about 27 other states have already agreed to expand their Medicaid programs. This ends up being a very political discussion. So the states that haven't, they're having similar debates as we are right now. But 27 states have already decided to do it. So again, we don't have a choice. We're paying all these dollars to the federal government as part of the Affordable Care Act, the new policies that went into effect at the beginning of this year, and we're not seeing the benefit. We're not seeing the benefit back in terms of better health care for people. And we've heard as we've traveled, as Secretary Hazel has traveled around Virginia, as the governor's traveled around Virginia, we've heard questions raised, concerns raised. What if the federal government falls back on its commitment to fund that coverage for all those people through the Medicaid program? And we'll just say that we've been participating in Medicaid since the late 1960s, and there hasn't been a single year when the federal government hasn't paid their 50% of the share that we've paid together to cover people in Medicaid right now. Now again, we don't cover a whole lot of people in Virginia. We're pretty stingy when we're compared to other states, and you saw what those numbers are for families. When we come out to, when you rank us and how much we're spending per person in our Medicaid program, we're number 48 out of 50. So we really don't cover a whole lot of people, and we don't spend a whole lot. But the federal government has never failed to pay its 50% share in Medicaid so far. And folks also say, well, Medicaid is not good health care. But as you saw in those very first slides, insurance coverage is insurance coverage, and it's a lot better than having nothing. Because at least you can get some access to basic care. And in fact, we're making a lot of changes in the Medicaid program. Right now, when you get coverage through Medicaid, you're really getting it through private insurance companies, through those Medicaid managed care organizations that serve a lot of the rest of the privately insured. Kaiser Permanente and Optima and Anthem, and all of them are participating in our Medicaid program right now. So it really is the quality is improving. It's like private insurance because it's the private plans that are still providing this care. And again, for those people who don't have coverage, this is really huge. I mean, it is a difference between life and death, honestly, and it's also a difference between many of our hospitals and our businesses staying afloat or not. So I'll just stop there and turn it back to you, Senator. Thank you.
Thank you, Dr. Lee. Now you all see why we brought her down to give this presentation for us. Last but not least, I want to have Gayleen Connaughton make her presentation. As many of you all know, she's heading up Celebrate Healthcare, and she periodically summons some of us, Senator Locke, Senator Delegate Brewer, myself, Delegate Howell, and Matthew James, to forums where people are actually telling us their stories about not having insurance and what we've done to try to get some of those people insured. And so with that, Gayleen Connaughton.
Right. Thank you, Senator Lucas, for putting this forum together, and I want to welcome everyone for being here today. As she said, my name is Gayleen Connaughton with Celebrate Healthcare. Last July, I woke up one morning and had this vision of the healthcare is going to start in October, and it was a vision was laid out to me exactly what we need to do in terms of, or what I needed to do to put something together to bring the community together and roll out the affordable care in Hampton Roads and throughout Virginia. We've done several throughout Virginia. We did over 30 events, what we call Enroll Fest. We've seen over 3,000 people. We enrolled over 1,500 people and had to turn away over 1,000 people too as well, because we don't have Medicaid expansion. At our Enroll Fest, we focused on educating people on the affordable care. We enrolled people. We talked about workforce development, because this is not only about enrolling people, which is very important, it's also about workforce development, because we got to fill these jobs once everyone starts getting health care. And then we partnered with the Urban League of Hampton Roads, Bon Secours, many other organizations, and also the U.S. Department of Health. Joanne Grossi came to several of our events, as well as several other people out of Secretary Sebelius' office came down and helped us with our events as well. You know, seeing over 3,000 people throughout the events and talks and everything that we do, you know, you see the importance of Medicaid expansion, and I'll just share a couple of stories. We had an event at the Hampton Roads Convention Center in early March, and we had over 800 people to attend. And right when we were getting ready to close, we had a 32-year-old young man came in, and he said, "I need to get health care." And I said, "Well, we're getting ready to close, sir, but I'll have someone call you." And he says, "No, you don't understand. If I don't get health care, I will die." And we all kind of froze. It was like, "You're going to die?" He says, "Yes, I have to have." And he just named off all of his illnesses that he had. He was 32. And he says, "I have to schedule a surgery within the next 2 months." So, of course, we ushered him on back, because we had enrollers from all over the state and locally that came in to help us. They come in and help us enroll people. And he was enrolled, and his premium was $16 a month.
$16 a month.
$16 a month. We've seen students pay as low as $14 a month. Single mothers of 3 have health care and dental and pay $88 a month. We've seen the success stories of the health care, but we also seen the stories where a person didn't make enough money to go into health care, to get health care. And you had to explain what Medicaid expansion is and why we need to have it. For someone to come to tell you, "I only make $8,000 a year and I need health care," or "I don't have a job and I need health care," and you have to tell them no, is very difficult to do. And we had to do it over and over and over again. So now, with healthcare being, the enrollment process being over, and it'll pick up again in November, we're going to have a series of workshops on, now that I have healthcare, what do I do now? And we're going to have workshops on how to read your bill, what is a deductible, how do I choose a physician? We're also going to talk about workforce development as well. And then in November, we will have a big enrollment event on the south side, and then we'll do smaller ones throughout Hampton Roads and throughout Virginia, because we went to Petersburg and several rural areas as well in the last enrollment period. And we'll make it even larger this time and go out through Virginia. And it's a resource fair as well as an enrollment. As it is our responsibility as humans to look after each other. And so everyone plays a role in educating each other, educating our families, our neighbors, friends. One of my missions is to see that we can get as many churches become certified application counselors. Can you imagine if we get churches become certified application counselors, that all someone have to do is go up to the street to the church to enroll? Can you imagine what it would be like to, when the information comes out, the churches will have the information, or organizations or businesses or anyone with a freestanding building that gets approved by the U.S. Department of Health. The information will be solid on the ground, and then all the noise that you hear of this will go away. So certified application counselors is not a difficult process. You can go on healthcare.gov. One of the requirements is that you have a freestanding building. You have so many hours a week that people can come in and actually enroll. It's a 5-hour online training that you have to do. So, for example, if a church becomes a certified application counselor, I've known businesses that have done it too. They can sign up as many people as they like to become certified application counselors, and then they can take that and go into other areas as well and enroll people. We need more people. We're not a state-run exchange, so therefore we're it on the ground, and we have to do as much as possible and educate each other and enroll if we can. If we have a church, if you have a freestanding building that you can offer people to come in and get enrolled, then that's what we need to do. We still have so many people out here that needs insurance. And people still call me today. And yes, there's challenges. There was challenges at the front end of healthcare, but I tell you, when I watched the news and everybody was complaining, you never saw anybody that was waiting to get enrolled complaining. There was no complaints at all.
That's right.
None. So, and people just wanted health care. That's all what they wanted. They wanted something, they wanted to get health care. And once they learned about it, they went back and they told their neighbors. They told their families, and they would come to another one of our events. And there are several organizations that were doing the same thing, enrollment events in Virginia Beach and Portsmouth and all different areas. But if we can get churches and strong organizations with freestanding buildings or offices that can offer hours for people to enroll, and we have our certified application counselors have the proper training, this next enrollment period in November, we can do more than what we've done this year. And this year, Virginia, reached its goal for that was mandated by the U.S. Department of Health. We reached our goal, so it was over 100,000. But we can do more than that in the next enrollment period. Thank you.
Thank you, Gayleen Connaughton. Well, we have one such organization in the audience tonight, and it's called WAGS. It's a women's advocacy group, and they are working on now trying to become a certified application counselor, and they will have a location. And so I'd like for the women of WAGS to please stand. Great. This is going to be your next. This group is comprised of many of the Greek letter organizations within the Pan-Atlantic Council. Now the hour has arrived for us to start hearing from those of you in the audience, and I know Reverend Hill has to leave early if he hasn't left already. He's left already. Okay. Then our first speaker then is going to be Kathy Revel, and she is with Chesapeake Free Clinic. So Kathy, if you'd like to come up and make your statement about what Medicaid expansion will offer for the clients that you have in Chesapeake.
Good evening, senators, delegates, and invited guests. Thank you for this opportunity to speak to you on the subject of Medicaid expansion in Virginia. I wish to speak in support of Medicaid expansion for low-income, uninsured Virginians. My name is Kathy Revel. I live here in Portsmouth, Virginia, but I work in Chesapeake. I'm the Executive Director of Chesapeake Care, Free Clinic, and Hampton Roads Dental Center. We are a safety net healthcare facility whose mission is to provide medical and dental care to low-income, uninsured residents of our community. We are funded primarily by grants and contributions from individuals and businesses in our community. We receive no federal funding, and we receive a small amount of state and city funding. We have a 22-year history of providing care for the uninsured in our area. I'd like to tell you a little story about George. Like many working Americans, George worked full-time, but his job did not offer health insurance or pay him enough money so that he could get health insurance on his own. You see, George is what is now come to be known as the coverage gap. Everything began to unravel for George when he found himself riddled with back pain. He was unable to qualify for Medicaid in Virginia, and his income is below 100% of poverty. So he is now currently in the coverage gap. He doesn't make enough money to purchase insurance on the marketplace, and there is no Medicaid expansion to take care of him. George was reduced to seeking care in our local emergency room, a practice that has cost our local emergency room tens of thousands of dollars in uncompensated care. Despite that, he was never able to get an accurate diagnosis for his condition because the emergency room would only take care of his presenting problem, which was pain. He was given pain medication and he was discharged. This went on over and over and over again, racking up uncompensated care bills for the hospital until finally George was referred to Chesapeake Care through our transitional care program. Because of our partnership with Chesapeake Regional Medical Center, we were able to get him the diagnostics that he needed, and he received a proper diagnosis. We found that he needed spinal fusion surgery, which we were able to arrange for him in the same hospital. Again, another bill for uncompensated care for our hospital. In Virginia, tens of millions of dollars of uncompensated care is written off by our hospitals every year. This affects hospitals in two important ways. First, the cost of the actual care has to be absorbed. And second, the failure to expand Medicaid will reduce the disproportionate share or DSH payments provided to hospitals for that care. This is simply unsustainable. In fact, there have been closures of hospitals in the western part of our state because of this situation. Luckily for George, his problem was corrected and he was able to return to work. However, he still needs additional surgery to continue working. Chesapeake Care, the free clinic, is coordinating his care, but we can do nothing for him when he needs hospitalization or surgery. George is typical of the kinds of people who would be served if Medicaid were expanded. He is a hard-working man. He doesn't want a handout, but if George can't afford medical care, his situation will cost us all. It costs us in lost productivity. It costs us in loss of employment and uncompensated care that the hospital must absorb. Ultimately, it weakens the fabric of our community. The majority of the patients we serve, about 70% of Chesapeake Care patients, would be eligible for Medicaid if it expanded. This would give these patients access to medical care, and for the first time ever, it would give them access to hospital care. But more importantly, expanding Medicaid would give that same access to the thousands of uninsured low-income residents that we are unable to serve. You see, Chesapeake Care is only able to serve 15% of those in our city who find themselves without health insurance. Our clinic has been around since 1992. Since that time, the number of uninsured Virginians has grown dramatically. And even though clinics have sprouted up all over the Commonwealth, tens of thousands of Virginians still have no access to care. Hospitals continue to lose hundreds of millions of dollars in uncompensated care, and individuals still face grave, life-threatening issues because they lack simple access to care.
Kathy, when we started, I had half the number of speakers that I have on here now. It has doubled, so we're going to have to try to hold everybody to a limit of about 3 minutes.
Okay. So I am asking that you bring our federal dollars that we pay in taxes back to Virginia. I'm asking that you protect our patients and all those patients we are unable to serve. It is the moral thing to do, it is the right thing to do, and it is the economically sound thing to do. Thank you so much for allowing me to share.
Thank you so much, Kathy, for coming. The next speaker was my college professor, and he's Dr. Winston Whitehurst. So, Dr. Whitehurst, you're up next, and thank you for coming.
I have a small statement that's being prepared, so there's copies for everyone. And if I don't get through it, then you'll have a chance to read it. Because I have been involved with a coalition of people for, starting with Teresa Stanley, Eunice Whitehurst, and Tim McCarthy. It had started 5 years ago, so we were in the beginning where we were advocating for the passage of the Affordable Care Act. And so, honorable members of the General Assembly and distinguished advocates for Medicaid expansion, I'm Winston Whitehurst, and I am a former teacher. Also, I'm a volunteer member of several organizations that are represented here today, and hopefully will get an opportunity to speak. Those people associated with Virginia Organizing, would you stand, please? Also, those associated with Virginia Interfaith, would you stand? And those who are associated with Empower Hampton Roads, would you stand? Also, thank you. There are 9 churches with whom I'm associated called Let's Make a Difference Coalition. And I saw Marie Graves come in. Marie, are you still here?
Yes.
So, Gayleen, when you talk about getting together with churches, we've already started, and we hope to have your assistance. In the fall, in October the 11th, we will have Dr. Melissa Clark come and do a pre-enrollment presentation, and hopefully it'll be around a 3-day workshop. And so that will be at Faith Deliverance Christian Church on October the 11th, helping people to get ready for the next enrollment, and also helping people who will follow up with Gayleen and understanding how to use your insurance when you have gotten it. So I think this is a great thing you're doing. However, my reason for being here tonight is not solely because of how it started, but the Holy Spirit awakened me one evening and said, you need to change your approach. And so today I want to say to you that Medicaid expansion, in terms of the General Assembly, is topic today that I would like for you to think about. Medicaid expansion, a spiritual vision for the Virginia General Assembly. Put on my glasses now. You know, at 82, you don't see too well without glasses. A spiritual vision is needed in the Virginia General Assembly as it debates expanding Medicaid. The economic and health benefits for implementing Medicaid expansion under the Affordable Care Act are well documented. You've seen some of the documentation. Therefore, the continuing refusal to implement the extension of Medicaid to people in the gap by certain leaders in the General Assembly amounts to rationalizing deliberate neglect. Now it is time for
honesty, and integrity to replace partisan decision-making regarding expanding Medicaid in Virginia. Moral inspiration should replace undocumented fear of failure as the General Assembly moves forward to provide a compassionate outlook on health care needs of its neglected working parents, low-wage earners, veterans, and citizens with mental issues. On behalf of these silent Virginians, I ask for the Virginia General Assembly members individually and collectively to examine yourselves with spiritual morality as you reconsider your stance on expanding Medicaid. Again, I ask all General Assembly members to avoid partisan, idealistic, conservative principles. The Virginia General Assembly is an institution for justice and fair, compassionate decision-making. Do not dishonor it. Please reconsider extending Medicaid with a positive outlook toward the future of Virginia. You have a glorious opportunity to pass legislation that will save lives, enhance economic growth by providing new jobs, and improve the quality of life of thousands of Virginians. This can be done with a resounding yes vote to expand Medicaid. Will you pledge your vote to support expanding Medicaid in Virginia? Thank you.
Thank you, Dr. Whitehurst. The next speaker is Susan Anders. Is Susan present? Yes, Susan.
Good evening, Senators, distinguished members of the panel, and guests. My name is Susan Anders, and I represent Faith Communities, where I have worked as a Minister of Social Justice for the last 10 years. I also represent the voices of the working poor, and I believe that we must ensure access to health care for all of us because it is the right thing to do. Health care is an inherent right of our humanity. This is a moral issue that should transcend the right and the left, liberals, conservatives, Democrats, and Republicans. It should not be a partisan issue because it is a life and death issue to all our fellow human beings. Virginia's healthcare debate should be about people, not about rhetoric. There are 400,000 hardworking poor Virginians who need access to health insurance. The Commonwealth Institutes estimate that 70% of these, as we pointed out earlier, are uninsured in the coverage gap, are actually working families. Cancer, diabetes, heart disease, and other deadly and chronic diseases are equal opportunity illnesses. They affect everyone, regardless of their ability to pay. Many hardworking Virginians who I work with on a daily basis work up to 80 hours a week, 2 or 3 jobs, and they are just a paycheck away from financial disaster. One medical emergency, mental health crisis, or a chronic condition can create for them a financial disaster. There's fear and uncertainty, lives unravel, families are torn, children suffer. And I tell you, ladies and gentlemen, there are not enough churches in this area that can make them right again, that can provide that safety net that is so critical to them. While there are 1 million Virginians who are uninsured, the Virginia pilot recently noted that there is perhaps a double standard being applied between our legislatures and our working poor. Certainly our legislatures recognize the importance and the benefits of health insurance. Senator Donald McKeegan pointed out recently in a debate on Medicaid expansion, he said, let us not forget that although sometimes we say we are working full-time, we are part-time legislators. and yet we provide ourselves with health insurance that rivals those in the private marketplace, that rivals those in the private industry. McKeegan said that if it's a good thing for lawmakers to give themselves coverage as part-time workers, then surely we can provide health care insurance for those who have no health insurance and go to work every day. I believe that closing the gap is a moral issue. Health care is a right, not a privilege. I believe that working families who pay taxes and are proud citizens of this Commonwealth deserve to be insured. And we must close the gap and expand Medicaid. I want to thank all of you for your leadership, and I want you to know that we will be praying for your success.
Thank you so much. Dr. Richard Brown.
Senator Lucas and distinguished panel. I'm a medical doctor, retired. My specialty is AIDS and infectious diseases, and I teach global health over at the Eastern Virginia Medical School. I want to quote the British wit Oscar Wilde, who once said that a cynic is a person who knows the price of everything and the value of nothing. We all know the price of medical care, and it's extremely expensive. We doctors charge too much, don't we? Medicines cost too much. A hospital bed overnight costs too much. Surgery is outrageous. X-rays, MRIs, and ultrasounds are just priced way out of sight. Medical care is expensive. We know the cost and price of medical care. We also know the price and cost of insurance. It's not cheap. Even the care that we're looking at tonight, Medicaid, that's quite expensive. Somebody has to pay. It's not free to anybody. Somebody has got to pay. Yes, we know the price. But let's look at the other side of being a cynic, which Oscar Wilde mentioned, that is, knowing the value of nothing. Do we know the value of what we're dealing with when we put a price tag on it? Well, you can't really put a price tag on the things that value most, such as life and health and happiness. These are the things that make life worth living. And so many people would nickel and dime the cost of health care that people lose all sense of the value of life as opposed to death, the value of wellness as opposed to sickness. We know how much we treasure our own health care. I wouldn't go downstairs and walk across High Street if I didn't have Medicaid, Medicare taking care of me. I'm sure everyone of the panel and everyone in this room has medical insurance, and we know that our tax-paying dollars pay for you General Assembly people, and we're proud to pay for your health care. We want to pay for it, and we want to keep on paying for it to keep you in good shape and keep you thinking well. But yet, when we look at how it's applied around the world, we know that the United States is one of the few countries in the world that does not have universal health care. We have it in France and Britain.
That's right.
And Germany. We have universal health care in Australia and New Zealand and in Japan and in China and in Russia and in Ukraine. When we look at the child mortality rates in Cuba, they have lower child mortality than we do in the United States. When we look at life expectancy in Japan and in France, both expect to live longer than people in the United States. All of these countries have universal health care. What's happened to the United States? Where we lost our sense of value and values. Oh, they have lazy people in Japan and China and France too. Yeah, we don't want to be the ones that judge who is deserving of medical insurance and medical care. It should be almost as natural as clean air to breathe. We don't ration it to the people who pay higher taxes or can afford clean air to breathe. It goes with civilized human beings. That's what we want the General Assembly to pass. Now, I feel like I'm preaching to the choir right here now. I prepared my remarks for Delegate Joanna, and he's not here, unfortunately, but I would like to relay my remarks to him. Thank you.
Dr. Brown, maybe he knew that you were coming because we only just heard this afternoon that he was not coming.
Thank you, Dr. Brown. Yolanda Davis? Yolanda Davis?
Oh, here she comes.
Hello. I'd like to thank y'all so much for giving me another opportunity to speak before you. As I was listening to Dr. Lee, I'm trying to hold back the tears. I'm one of the ones who is trying to help close the gap because I don't have medical insurance. This past weekend, I passed another kidney stone. And I think this was the worst one I had in the past 6 months. I was in my bed on a Friday night watching TV, fell asleep, and I felt the pain. If you ever seen that movie, Heaven is for Real, there's a young man in that movie who actually had kidney stones, but I'm quite sure he had medical insurance because he was able to go to the doctor. This pain here was like someone had put me against a wall and had like 20-some people each had a knife in their hand and they threw it at me. That's how the pain felt. To actually pass a stone, and I know in my mind I don't have medical insurance, it's hard. I actually drove myself to the hospital on early Saturday morning. Didn't go in because I already have a hospital bill from when I had a minor stroke that I have to pay. It's not fair. It's not. We need to do something because I don't want to be the ones that have to wait until it's too late to go to the hospital because I'm going to have to be on dialysis because now my kidney is damaged, or because I don't have the medical insurance to get the proper treatment that can prevent this, or to get the care where I can have pain medicine because I can't swallow pills, so of course I need to get prescription to get liquid medication. Again, it's not fair. I work hard, pay taxes, but I fall in the gap where I don't have any kids, I'm now over the age of 65, and I'm tired of hurting. I'm tired of going to the hospital and don't want to go in because I had to make a decision. Do I want to go in and get treated, or do I want to get stuck with another hospital bill and then have the collectors calling me like they did today, asking for money? What are we going to do? I'm tired. This is the longest I've been without medical insurance. I used to have private insurance. When I needed to use it, they only paid but $25 of the bill, and I was stuck with everything else. But my premium was over $300-some a month that I was paying for. So it was a waste of my money that I've been paying into this for over a year. When I really needed to use their insurance, they only paid but $25 of the bill, and I was stuck with the rest. I need medical insurance, and this right here can help me. I don't know how my condition is now. All I know is I pray that y'all would never have to go through, a man or a woman, having to pass a kidney stone, and you know in your mind you can't go to the hospital and get treated because you don't have medical insurance. Thank you.
Ms. Davis, is why we need Medicaid expansion. Before moving on to the next speaker, I'd like to recognize Denise Good, who's here from Senator Warner's office. Mark Warner. Next speaker is Alexis Edward.
Good evening.
Good evening.
My name is Alexis Edwards, and I am with SEIU Virginia 512. I currently work in human services, and all of the clients that I provide services to rely on Medicaid to meet their critical needs. These clients work hard, they make minimum wage, and cannot afford sufficient health care. That's why I'm here tonight to talk about how Medicaid expansion can save money and lives. Preventative care and treatment of chronic conditions reduces the need for more expensive services. For example, screening and early detection reduces death rates, improves treatment options, and greatly increases survival. Early treatment of diseases save lives, and health insurance provides financial security to families who might otherwise incur substantial medical debt that will probably have to be written off. Medicaid expansion will also boost Virginia's economy. The Affordable Care Act provides 100% federal funding to support expansion through 2016. This very significant federal funding will create 30,000 Virginian jobs. Each day lawmakers don't expand Medicaid, Virginia loses $5 million in available federal funding. This means the federal tax dollars you and I are paying will go to other states instead of staying here in Virginia. On behalf of citizens, voters, and constituents, we ask that you support Medicaid expansion today, tomorrow, and in the future. Thank you.
Thank
you. Before moving to the next speaker, we'd like to recognize Congressman Bobby Scott, who just entered the room, and we'd ask him to please come up and say a few words. He says to keep going.
Well, I'd like to recognize one other member of City Council who has arrived. I see Councilman Bill Moody in the back. So, Councilman Moody, thank you for joining us.
The next speaker is Ken Arenthal.
My name is Kenneth Arenthal, and I live in Chesapeake. I'd like to thank the panel for giving us the opportunity to discuss with you the expansion of Medicaid in Virginia. You've heard and we've heard many opinions about the expansion, both positive and negative. But please, as you listen, especially to the negative opinions, keep in mind that every speaker has themselves access to comprehensive medical care.
Thank you so much.
Thank you.
Wow.
Deborah Grant.
Good evening.
Good evening.
My name is Deborah Grant, and I am the Interfaith Chairperson and a mother of a daughter and 2 grandchildren that live in Portsmouth that is affected by the affordable health care issues. I thought I might give you a few powerful statistics tonight. 40% of those who are currently uninsured in Portsmouth fall into the coverage gap. That is 4,600 Portsmouth residents. That's a lot. The reality is that people who could get coverage live and work in the city and in the county in Virginia, including the hometowns and lawmakers who are opposed to expanding the coverage.
Mm-hmm.
It's time for the lawmakers to do the right thing for their constituents, for my grandchildren, for my children, for my loved ones, and close the coverage gap. My sister, who is 59 years old, who's never had health insurance, was able to get affordable health insurance for the first time in her life. when she went and made her first payment, the first of the month, she cried because she was able to get health insurance. She was able to go to a doctor to have her health care needs taken care of. She has high blood pressure. She has a whole lot of things going on. And I want to see my sister alive. And I am so grateful that she was able to get this. But she is just one of the many people that could benefit from this Medicaid expansion. And it's my daughter, as I said, my daughter lives in Portsmouth. She lives, bought a house. She works at Virginia Beach General. She's a chef, she's a cook over there, 2 single parent. And she is able to get the health insurance, but it's not affordable because she has 2 children and she has to pay for them. And she has health problems that's going on too. But I'm so grateful that she can get what she can get. And I'm so grateful that my sister can get it also. I ask you again to tell the lawmakers who are not here, because all of you are here on the panel right now. You believe in the health care, Medicaid expansion. The ones that are not here are the ones that we're talking about. So again, I thank you so much for listening to me this evening. I'm very passionate about this healthcare. I am a one-woman show. I go and sign up everybody. Anybody that, that needs the health insurance, I'm there. So just please do the right thing. Go back and tell them to do the right thing. Okay, thank you so much for listening to me.
Thank you. Marcus Grant.
Thank you for giving me an honor to speak tonight. I come to you as a student. I go to TCC. I'm a cashier at Farm Fresh. I also come to you as a son. I had health insurance since I was 19. A couple of months ago, I was able to get health insurance. But unlike me, my friend Jeremy wasn't able to. He called and he fell a couple of dollars short because he was not able to qualify for it. Just like him, many other, young people like myself are not able to qualify for it. And it's a shame because we work hard, just like the normal common folks. Some of us, like me, have 2 or 3 jobs. And we believe that, that's the one thing we're entitled to. And if you could just make this right, that would be the only thing that we would be grateful for. Thank you.
Athena Jones.
Good evening, everyone. My name is Athena Jones. I live in Portsmouth, Virginia. I am also currently a home care worker. I continue to listen to all the people on the panel as well as the people in the audience admonish those who are in office to listen to our plea, to understand that we are here and we want to be heard. But unfortunately, there are those that aren't listening and only see the cost behind this issue. When we only look at cost, there are a lot of things that are automatically negated. The legacy of a family is automatically negated. The future and destiny of our hope and dreams for our children are automatically negated because of cost. And when I continue to think about that, so now we as Americans, many who have bled and died so that many of us can sit on the panel, sit in the audience, homogenized by the history of our peoples, we now come to a place where healthcare now continues to divide us. Why? Because of cost. Is that fair? That just because there are legacies that have been brought in via through slavery, other issues, but we can't even afford to get health insurance. There are many workers out there, like home care workers, who save the state billions of dollars a year in the state of Virginia, but cannot afford health insurance. It's cost. There are people who live at home with family members where now not having health insurance is the norm, which we've heard. And so it's like, well, I'll see if it goes away, I'll take an aspirin. Well, it's just what you do because you're old. So now the legacy is no longer the wellness and the future and the opportunity to be enjoyed as a family, but the struggle of health issues that is surmounted by the issues of economics. Because you do not fall into that specific socioeconomic status, the cost of living in America. So do we want to be this nation? We always talk about the land of the free, the home of the brave, the opportunity for anyone. If you pull yourself up by the bootstraps, you can do anything and be anyone. But that only works if you have the right cost. So I ask today, and for you guys to admonish those who sit across you in the aisles, that this should not be about cost. This is about the legacy, not just the legacy of now, but the legacy of the future of the children's children, to say, yes, my great-great-grandmother fought for health care. And she was able to get it. My great-great-grandfather was able to survive because he had health care. This isn't just about right now. This is about the future, not just of us, but of the people that we hope to inspire. So we were more than that. And I hope when you guys go back, you tell them the stories of the people and let them know, good sir or good ma'am, this is not about just cost. This is the legacy I want to leave behind. Senator Kennedy said he wanted this to be his legacy. I had the opportunity to sit in the Senate House and listen to him speak about health care. I had the opportunity to lobby on the federal level for a public option for everyone. But it always boiled down to cost. So if I need to get out the cost, I'll get out my little pennies and nickels and dimes and say, well, what is the cost now for us to be healthy? And then let's see if we can make that available for everyone, because that should be our inalienable right in the United States. Thank you.
Wow. Sister Grace Malonzo.
Senator Lucas, congratulations on your tenure, too.
Thank you so much.
I'm Sister Grace Malonzo. I'm a daughter of wisdom, and I also belong to the Sowers of Justice. I think the majority in this room are pretty well off, and we're grateful for what we have to God. If we were among those who are hardly getting by, I'm sure we'd quickly accept this serious issue. The money is there at this time. We have the opportunity and the privilege of reaching out and helping our brothers and sisters in need, even if it is not going to be so many years ahead. But now we have the money. So now, please don't let this responsibility pass into oblivion. It is the right thing to do. And also in that gap are veterans. And I have a very good friend who's homeless. His name is Chuck. The last time I saw him was Christmas. And I just saw him, and looks like he has a big cancer on the side of his face. So he's in the gap with so many other veterans, too. So we have to help them. Thank you.
Dr. Shabazz.
Steve Stanley.
Good evening, Congressmen, members of the General Assembly, and other esteemed panelists. Thank you for the chance to speak this evening. My name is Steve Stanley. I'm a small business owner in Hampton Roads, a 15-year member of the AARP, and a volunteer with Virginia Organizing. According to Bill Callio, director of AARP, in an article that appeared in the Virginia Pilot about 6 or 7 days ago on the 6th of May, if the public wasn't already confused about Medicaid expansion, recent inaccurate statements by House Speaker William Howell referencing how the Affordable Care Act cuts Medicare and harms its beneficiaries and then uses that as an excuse for denying hardworking, uninsured Virginians Medicaid expansion is ridiculous. To further quote from his article, the ACA totally prohibits cuts to Medicare benefits. It slows down expenditures and will end up saving over $700 million in the next 10 years. It comes down hard on those who attempt to defraud, waste, and abuse Medicaid and recaptures dollars that were not going to real health needs of our citizens. Many of those who oppose Medicaid expansion argue that the existing program should be reformed to eliminate waste, control fraud, and improve services. The truth is, the Affordable Care Act does exactly that for Medicare. Overall, Medicare is strengthened by the ACA. People are spending less money, and their Medicare benefits are both protected and expanded. As a small business owner in Hampton Roads, I have been gratified to see the Chamber of Commerce leaders across the Commonwealth have been actively letting our leaders in Richmond know that Virginia businesses strongly support a market-based approach to closing the Medicaid gap. Businesses and individuals in Virginia have already paid nearly $600 million in taxes to Washington just the first 4 months of this year, 2014. Those dollars are lost, they're gone. And they're going to continue to be lost in the state of Virginia because of our failure to close the Medicaid gap. I urge Virginia, I urge the General Assembly, I urge lawmakers to avoid trying to confuse the constituents regarding changes in Medicare and the expansion of Medicaid, and dedicate themselves to making Virginia a state that provides low-income, uninsured families with the coverages they need to be healthy. Thank you.
Thank you.
We'll now go to Congressman Scott.
Thank you, Senator Lucas, and members of the General Assembly. I just wanted to stop by, not to speak, but to thank the members of the General Assembly here for fighting as hard as they can to expand Medicaid. We passed it on the federal level. We expected it to be enacted. And you have 400,000 Virginians that are depending on your work, so keep up the good work. I've been listening to some of the comments, and it's interesting that 400,000 people can benefit, would pick up about 30,000 jobs. And we heard a question of cost. The cost, if we expand, there will be more money in the general fund than if we don't expand.
That's correct.
About $100 million.
That's correct.
Now, I mean, it's hard to explain that to people, because usually if you're going to expand the program, you got to cut something else. No, when somebody goes to MCV Hospital and doesn't pay, Medical College of Virginia Hospital doesn't pay, or UVA Hospital and doesn't pay, they just don't pay. But if you give them a Medicaid card, they will be paying with federal money. That's money the state didn't have, added up about $100 million a year. So, incredibly, you got to cut spending in order to deny people their benefits. I mean, it's just hard to explain. It's so incredible. Rural hospitals can't survive. We changed the Medicare and Medicaid formula because since we've provided universal access, those hospitals that treat a disproportionate share of indigent care are going to lose those payments because nobody's going to be indigent. Everybody's going to be covered. The University of Virginia calculated that they're going to lose $140 million at the University of Virginia
Hospital $140 million over the next 10 years by the reduction in what are called DISH payments, disproportionate pay payments, $140 million a year over the next 6 years. If we expand Medicaid, they'll pick up $280 million. Now, if you don't expand, all they have to show for it is a $140 million reduction. Now, trust me, the University of Virginia Hospital is going to be there. It's backed by the whole state. Rural hospitals hit with the same kind of hit won't be able to survive. And so you're going to close rural hospitals if we don't expand. And add insult to injury, since 400,000 people will get sick and show up at a hospital, everybody who has insurance will be paying a little bit more because you got to cover yourself and the 400,000 people that don't have insurance.
That's right.
So if you don't expand, you're raising everybody's cost. You're losing $100 million out of the general fund. You got 30,000 jobs won't be created. You got all of the rural hospitals going to have to close all of that in order to deny 400,000 people their coverage.
That's right.
Now, I mean, some decisions that politicians have to make are hard. Some are hard. But if you think, I heard one person who was opposed to it say, yeah, I've seen the polls that people want to expand, but what would they say if you told them that you got to raise taxes and cut spending in order to provide that benefit? My reaction was, that's an interesting question, but we've already paid the tax.
That's right.
As the gentleman just said, we paid the tax. Now, New York is getting their benefit from it, and California and all these other states are getting their benefit. We paid the tax and get nothing for it. And you got to cut spending? No, you got to cut spending to deny the coverage.
That's right.
So, you know, when the people have to misrepresent the facts in order to explain their position, you know their position doesn't make any sense. But we got some legislators up here who are working as hard as they can. Now, let me just, one other thing. Somebody mentioned the public option. I was fighting for the public option, too. And as a matter of fact, I want the whole thing public. Go to a single-payer plan. We wouldn't be having this discussion. But we went to the, essentially, Romney Care, which gets the job done, not as well as a single-payer, but gets the job done. That will save the taxpayer money, because the public option would be out there competing with the private sector, making sure that the costs remain low. The private sector can charge all they want, but when you got the public option up there, they'll start losing market share if they get too greedy, and that keeps costs down for everybody. So I just want to thank these legislators for being able to figure out that we paid the taxes, we're entitled to the benefit, 400,000 people can benefit. There's not only no cost to the state for 10 years, there is more money in the state coffers. And I was told that a CPA in the Senate came up with a scheme. After a few years, it gradually goes up to a 10% match. First 3 years, 100%. That if you take that $100 million extra in the general fund and don't spend it, but invest it every year, when you start ending up having to actually pay, you got enough generated from that trust fund to pay the copay, the 10% in perpetuity. So it really never costs anything if you adopt the CPA's strategy. So you got a no-cost, 400,000 people benefit, 30,000 jobs, rural hospitals can stay open, and all our insurance rates go down. This is not a hard decision. And I want to thank our legislators for continuing to fight on behalf of 400,000 people and everybody in the Commonwealth. Thank you for all that you do.
Barbara Willis.
Good evening to the distinguished panel. 19 years old. Had Medicaid all my childhood. Needed it because I was a sickle cell child. 19 years old. Medicaid in Virginia stopped for me. Haven't been able to work, not a steady job, because those attacks can come at any time, particularly when I'm stressed. 19 years old. Never knew that how important health insurance would be for someone like me until I turned 19 years old. This is the kind of story you hear if you talk to the individuals at CHKD who are trying to figure out what do we do now with these children that are no longer eligible for Medicaid coverage.
That's right.
These are some of the people that are affected by that. They never heard of an organization like mine. I'm Barbara Willis, CEO of Hampton Roads Community Health Center, federally qualified health center located in Portsmouth, started by the mayor of Portsmouth through a medical task force looking to see how to improve access in Portsmouth for people who need health care. Through that task force was developed our health center, which has been around now for 20 years. We consider ourselves respectable taxpayers. We have a pre-tax of $225,000 that is put back into the coffers of this community. We have over 50 employees. 12 of those employees are providers, meaning that they are pediatricians, family practice, internal medicine, OBGYN, and dental providers. So as we are committed to this community, our mission is to provide appropriate health care to individuals regardless of their ability to pay. So we've been seeing quite a few uninsured and underinsured in the community for quite a while. But let's look at Portsmouth. With the Portsmouth residents, we have been servicing about 3,354 who do not, of that number, 1,466 did not meet or have the ability to be covered through the health insurance marketplace. But we're still seeing them. Some of them are paying $25 for a visit. And that visit, on the average, would cost an individual between $300 and $400, particularly when you add in the cost for medication. $25 doesn't go very far, but the federal funds that we receive help to support that, but it cannot continue to sustain the organization, just like the hospital. We're here to serve, but no mission, no margin. So we have to continue to look at how or what can be done to help those individuals who can't help themselves. So that's why I'm standing before you, is to implore you to continue to keep up the fight that we may have the coverage gap filled that needs to be in this area. Now, may I just take a brief moment and take off my Barbara Willis CEO hat and be a citizen? Showing my age, I remember the flower power days, burn the bra. You know, people can't understand your pain unless they feel pain themselves. I suggest that a movement be started, that the legislators who are concerned about the coverage gap, that they should burn their insurance card so that they can feel what the everyday citizen feels. Because to continue to use a moral issue to take a political stand, somebody else is going to die as we speak. And so where is the political gain when you bury another person unnecessarily? Thank you.
Wow.
Costello Ledbetter.
Good evening, everybody. Costello and I are doing this together. I'm Seneca Bach with Community Capacity Builders, and I'd like to take this opportunity to say thank you very much for holding this forum, Senator Louise Lucas. We really appreciate it, and it's high time. My name is Seneca Bach, and I'm a native of Hampton Roads, Virginia, and a proud voting citizen of Virginia. I am also a longtime social justice advocate and activist representing the interests of the poor, working poor, and those citizens who are often marginalized. I am here standing with Empower Hampton Roads as well as Virginia Organizing. My company, Community Capacity Builders, LLC, is a small woman-owned business serving low-income women and their families for over 25 years by providing training and technical assistance to systems that support their long-term success. I have watched as our clients struggle to make ends meet, even as they work day to day and become tax-paying citizens. Myself and our other Healing Sisters, which is a health missionary ministry, over 3,000 strong, are here today to say that we are frustrated and literally disgusted by the egregious acts shown against over 400,000 Virginians who fall in the Medicaid coverage gap. We are currently working with the CDC to provide chronic health disease prevention programs throughout the state, and we witness every day the struggle to access affordable health care, quality health care, amongst those we serve. We are working very closely with many companies and organizations here to provide diabetes prevention, for an example, and many of our clients cannot afford the health care that they need. Additionally, we would like you, I'm going to have Costello read this piece. Go ahead, Sister Costello.
Okay, my name is Costello Ledbetter, and I'd like to thank each of you for giving us an opportunity to speak with you on this evening. This particular situation with ACA, I'm very passionate about it. I could tell you a lot of different stories, but I know we are on a time frame here. But I do want to make a plea to each of the legislators to make sure that you do everything within your power to make sure that this Medicaid expansion is what we must have. Anytime you have 400 uninsured persons in your state, something needs to change. And we've heard so many stories, and it just brings tears to your eyes to hear the struggles that families have to go through. Many of us are fortunate enough to have what we need, but all of us have some friends or family who don't have that, and we need this. I must share a story with you because in my hometown, in the month of February, I looked in the daily newspaper, and there was a long list of obituaries. There were so many that I counted. It was 12. I said, oh my God, what is going on? All these people dying. Now, I work with Ms. Bach, and we are working with chronic diseases, mainly diabetes, okay, through the CDC. But when I saw that list of names, I had chills. I said, oh my God, because I looked inside the paper to see who had deceased. Out of the 12 people who had passed away, 10 of them were African Americans. I said, oh God, these people got sick and they had no health insurance. They went to the emergency room and it was too late. Now, all of those people were not old people. They were various ages, young people, middle age, whatever. Only 2 days later, I looked in the same newspaper, and there was another long list. I said, God, what is going on? All these people dying. It was 10 that time. Out of those 10, it was 8 African Americans. I said, oh my God, I know I must continue with what I'm doing because we are losing too many people. People don't know. They need to be educated about what they can do to help themselves. And we who are advocates for them, we must continue to be advocates because our people are hurting. They are dying, literally. And we have to do something to save them. And do you know, everything that we don't do and we can do, God is holding us accountable. We better get it together, people. Take it back to the legislators who are not here and who don't think that this should be done. Do everything in your power to make sure they do. And I like what the lady said a few minutes ago. You don't have to burn your bra, but you can burn your card. Thank you.
Teresa Stanley?
I'm just going to say bravo to every comment tonight, and especially to the legislators that are working so hard to make sure that this happens. Please tell us what we can do to have your backs.
We could have a forum in Virginia Beach.
Rita Bryan?
Good evening. Senator Lucas, thank you so much for having this, and distinguished guests. What an honor and privilege to stand before you. I'm going to be very short, concise, and to the point. On behalf of American Cancer Society and ACS CAN, we stand behind you. Just to give you some figures, just on cancer alone, Portsmouth is ranked number 3 out of the 35 health districts in breast cancer mortality. We are ranked top in lung cancer, in colon cancer, in cancer alone. There are going to be estimated over 14,000 Commonwealth residents that will die of cancer this year. If lawmakers could prevent some of those deaths, wouldn't increasing access to health care be worth doing? I feel like I'm speaking to the choir, but hopefully our representative is taking very good notes to take back to the delegate that is not in support of this. The Portsmouth Partnership to Beat Breast Cancer was an initiative due to our corporate sponsors, and we're able to provide free mammograms for women who are 40 and above uninsured in Portsmouth. Mr. Kerner, we are working with your system.
Yes.
I will stand as a personal note, and to the other survivors here, as being diagnosed with breast cancer in 2002 and again in 2007. So I stand as a manager of the chronic illness of stage 4 cancer. I stand, God is good, and I'm not the only one here that is survivors. I'm not the only one here that's fighting for our family members. I'm not the only one here that's fighting for our coworkers. I will tell you that with full disclosure, I am a 22-year Navy veteran, and I have access to the awesome healthcare system of Naval Medical Center Portsmouth. So I stand here for the 14,000 people that may die prematurely. I stand here for the family members that may unnecessarily have to see their friends and family go through a premature death unnecessarily because our representative that's not here this evening will not make that decision. And I will tell you that American Cancer Society over 100 years will stand behind the right thing, the right choice. And Ms. Barbara Willis, I will tell you that we do not promote smoking, but I will provide the first lighter to burn that insurance card for that delegate.
Oh, I have to get my tears out of my eyes so I can see. We have Denise McClure. Could I get you to please come forward?
Good evening. My name is Denise Hunt McClure, and I come before you to tell you a little bit about what's going on with me. I speak of a person that has insurance, but I fight for those that do not have insurance. 6 years ago, I was diagnosed with myelodysplasia syndrome, which is MDS. And for those who don't know what that is, it's the same disease that Robin Roberts had. My disease is unknown where it came from. I started off with shots, blood transfusions, and now I take chemotherapy every month. I've been taking chemotherapy since 2010. My chemotherapy is very expensive. Every month, it's a $4,000 bill just for the chemotherapy. Then after I get my chemotherapy, I have to get a shot. That's $2,000. Now, the insurance does pay for some of that, but a lot of that is still left on me. I speak before the patients that have MDS, that are undiagnosed, that are untreated. The chemotherapy is slowing down the progress, slowing down the disease. The disease can turn into leukemia. So therefore, I'm speaking to all of those who are against the Medicaid expansion. I speak to those to say it is definitely needed because this disease can be maintained. My last result with treatment will be a bone marrow transplant, and I hope that that's something that's further down the road. But there are a lot of patients just like me that just don't know that they have this disease because they don't go and get those medical checkups or physicals to get this treated. And if I had not got insurance, I would have never known, and I would never be here. So I'm thankful for the insurance, and I'm thankful to be here. Thank you.
Thank you. Paula Sales.
Good evening. I want to thank Senator Lucas as well as the rest of the panel for allowing me to speak today. My name is Paula Sales, and I'm a member of the Women's Advocacy Group, but I'm here because I have a personal story to tell. I am a breast cancer survivor. Almost 10 years ago, I received a call from my doctor that, of course, completely changed my life. The biopsy I had 1 week before showed that I had stage 2 breast cancer, and it was definitely the most frightening time of my life. It was also the start of a battle that will never end, not only with the disease, but with the challenge of paying for any preventive measures necessary to keep me cancer-free. It's important to know that at the time of my diagnosis, I was 43 years old, which is below the national average age for a breast cancer diagnosis. And in addition, I was also diagnosed with having HER2 positive breast cancer, which tends to be very aggressive. And of course, the more aggressive the disease, the more aggressive and expensive the treatments. Mm-hmm. During my first visit to my chemotherapy doctor, I was told that I would see 3 doctors on a biweekly basis. And surprisingly, not one of them decided to volunteer their services. I had a medical oncologist, a surgical oncologist, and a radiation oncologist. And to quote my medical oncologist, because of my age and the type of cancer I was diagnosed with, their plan was to hit me with everything they had. And everything included the doctor's visits, a surgical procedure, 8 chemotherapy treatments, 33 radiation therapy treatments, and a year of what was then a new treatment for HER2 positive breast cancer survivors, Herceptin. It's no exaggeration to say that every time I walked into a medical facility, the cost was no less than $2,000 and as much as $7,000 per visit. Now, fortunately for me, I am one of the lucky ones because I do have health insurance. When I decided I would speak to you today, I decided to review my own medical records. I looked at around 42 pages of medical procedures, tests, and doctor's visits. And I remember a statement that I made often to different family members and friends. What would I do if I didn't have health insurance? I was fortunate that the information I reviewed included amount that the medical provider paid and how much they covered. I did have out-of-pocket expenses, and I used up all of my sick leave and personal leave, and I was often forced to take leave without pay. However, I still consider myself to be fortunate because I don't know what would have happened if I didn't have health insurance. I could not possibly have covered the costs for my medical treatment. And in that case, would I be standing here before you today? Without that coverage, would I have been visiting my doctors on a regular basis? Would I have received an early diagnosis? Or would I have been diagnosed so late that nothing could be done for me? Mm-hmm. As we have heard before, this is happening, and it's happening right here in the Portsmouth community. As Frida mentioned, we have one of the highest mortality rates for breast cancer in the state of Virginia. And often it is only because of a lack of access to medical care. And it's not just with cancer. I often wonder how many people who suffered strokes, who suffered heart attacks, or renal failure would still be with us today if they had been diagnosed in earlier stages. One of the things that happened when I was diagnosed and going through treatment was that my mother was diagnosed with end-stage renal disease. Our days consisted of me going to work, picking her up from her dialysis treatments, going to my radiation treatments, and finally home for dinner and whatever expensive medications we were both prescribed. But I thank God that we both had medical coverage. If we didn't, would my family have been blessed with 5 additional years with my mother? Would my mother have had the opportunity to see her grandsons grow into men that she could be proud of? Without our medical coverage, would I have been at my mother's bedside when she took her last breath? Or would she have had the misfortune of mourning her child before my time? I urge you to do whatever it is within your power to help to provide quality health care for all citizens of the state of Virginia, because as you can see, our lives are in your hands. Thank you.
We have about 10 more speakers, and the hour's getting late, so we need to be conscious of the time, but the lights are kind of blinding me and keeping me from seeing, but I think I see in the audience a gentleman that I sat next to about 40 years ago when we served on the Hampton Roads Planning District Commission. Is that Art Collins? I thought so. Is that Joe Donnelly next to you? And who's next to you, Joe? I can't see. Bobby Bray. Bobby, and who's next to you, Bobby? Thank you all for coming. It is your support that helps us to keep doing this also. We really appreciate it. And now I'd like to bring up Ms. Cynthia Small. Is she still here? Okay.
Good evening. I'm Cynthia Small. I'm a native of Portsmouth, born and raised, have always lived here. I myself am a healthcare provider. I actually work 2 jobs, one at 32 hours a week and one at 24 hours a week. I definitely can identify with where you say some people work 2 jobs and they still don't qualify for medical insurance. I have 3 grown children, and none of us had insurance. After 2006, I was working in industry at the time, and when the company decided to pack up and send our work to Mexico, I found myself without health insurance. And so found myself dealing with the clinic. And in Portsmouth, we had the Hampton Roads Clinic, and we had the Maryview Foundation. I tried to deal with the Hampton Roads Clinic, but as a result, they go by your income, also portions of your income and your prescriptions. And so it was just like if I was going to the doctor and paying, they would give you some prescriptions and say you could take them to the social service department to get some help with them, but some of them they would turn down and say they weren't going to cover them, or they were up to their limit and they couldn't fill anymore at the time. And so I found myself with Maryview Foundation. I suffer from hypertension, and I needed medicine, and I was going into a situation where I was at risk for a heart attack and a stroke. My pressure was out of control, and so they recommended Maryview Foundation. Maryview Foundation is what actually really saved my life, because they provided the medication that I needed. The medication that I needed, you could get there. You went every 90 days, and you didn't pay any money as long as you qualified to go. I've been with the foundation. As of the first of the year, the foundation, I don't know what happened, but they lost their doctors. They had a nurse practitioner and one doctor. So they've been operating without a doctor. I had 3 doctor's appointments canceled. But one of my daughters is an RN, and she has a chronic disease, and she works for Chesapeake General. And as a result, she had to go on a PRN status. So she didn't have medical insurance. She found herself sick a lot. Her hospital stays were 3 and 4, sometimes 5 days. She was incurring like $13,000 hospital bills in 3 days. One thing you don't want to do is older people where you work at. So she was working at Chesapeake General, so she had to hurry up and stop going there. So what she did, she went to Maryview a couple of times, and then she found herself at Centera in Norfolk, and she had a gastrologist. And like Dr. Lee said, when you don't want to pay a bill and you're afraid of incurring more bills, you won't go. And so times that she should have gone, and she didn't have to pay for the gastrologist, she didn't. So she found herself in a worse state. And the same as I, because you go to the Maryview Foundation, you get your medicine. Only thing they can do for you is recommend you. If I need a colonoscopy, they can send me, but I have to pay for it myself. If I need an MRI, they can send me. I have to pay for it myself. They tell you what it costs. If you think you got the $300 or the $500 or whatever you need to put down at the time, then you can do it. If you don't go. A lot of times you don't feel well, you really need to go to the emergency room. You know something has been going on with you for a while, and you won't go because you don't want that bill. Years ago, hospital bills didn't play a real big part with your credit. It used to be, okay, well, you could get away with it. Now every time you make a bill, that hospital bill goes right on your credit quickly, right away. You want to see your credit rating and go hurry up and go down. Used to, they would overlook. Even renters would say, okay, well, we're not actually looking at that. They look at everything now. So we found ourselves, I did get an opportunity to apply for the affordable health care. Some kind of way, I was at the first initial when the people from DC came down and met at the clinic. I went to the Edmonds Center. That's when we actually signed up. Some kind of way, they got us in a Medicaid status. So I didn't hear anything. We didn't hear anything. We said, well, what's going on? So when we went online to check our status, they had us on the Medicaid. We said, oh, we're going to get Medicaid. So they had talked about it. They had said that we had not talked with Lucas, that they had said that they didn't get anyone to say that we were interested in Medicaid. And she said, and they also said, Johnny said that he hadn't heard from anybody and that we need to go down to their offices and let them know that they were interested. But how would we know when we didn't even know what the plan was about? It just didn't size up right. It didn't sound right. So I did get something from social service. It was a stamped receipt saying that they had received it, and it had a nice little notation saying, this is not a guarantee. I said, okay. So I waited, and I'm going all around, I'm getting people signed up. And I'm even in the newspaper. They done put me in the newspaper like I got it. I didn't have anything. So I said, my daughter said, Mama, they said, Virginia's not gonna get it. So I waited, and when we thought we weren't gonna get it, and we were in that Medicaid, we went online ourselves, we put in, and we got it right away. But my one baby girl, she just graduated criminal justice. She works for the city of Portsmouth, part-time in Parks and Rec. She didn't make it. My daughter made it, and I made it. But my other daughter, she didn't qualify.
Gayleen is going to work with her.
Okay. Well, this is where I stand, and I'm just glad that I was led to go on and persevere and see about it myself, because if I had waited, I would not have had any insurance. And like I said, I'm dealing with the foundation. The foundation just got back their doctors last month. Everybody had been on hold. They were only could give out medication, but they did not have any physicians in place.
Thank you.
Thank you.
Rosetta Rowland. And it's nearing 9 o'clock, so if we could keep our remarks brief. Thank you.
Well, thank you. Good evening. My name is Rosetta Rowland. I'm the chair of the Advocacy and Government Affairs Committee for the State Board of the March of Dimes. And the mission of the March of Dimes is to improve the health of women of childbearing age, infants and children by preventing birth defects, premature birth, and infant mortality. The uninsured report poorer health status than those with health insurance. They're less likely to have the usual source of medical care and fewer prenatal services, and report greater difficulty in obtaining needed care than women with insurance, according to the Institute of Medicine study. In Virginia, 294,000, or 18% of women of childbearing age, are currently uninsured. Of those women, 110,000 would become eligible for the Medicaid expansion and covers the non-elderly individuals up to $133,000 of federal poverty level. Over 30% of individuals newly eligible under the expansion will be of women of childbearing age. Offering these women coverage under Medicaid would give them access to preconception, interconception, and postpartum care that's crucial to improve the health of mothers and infants to reduce the risk of preterm birth. Health care before, during, and between pregnancies is important to help identify and manage conditions that contribute to premature birth, to begin prenatal care early, and to help improve birth outcomes. In fact, expanding Medicaid could help Virginia achieve the March of Dimes Association of State and Territorial Health Officials challenge to reduce the state's rate of preterm birth by 8% by the end of 2014. In an average week in Virginia, 235 babies are born preterm. Prematurity and low birth weight is the leading cause of death in infants in the first month of life. Babies who do survive can face risks of lifelong challenges such as cerebral palsy, intellectual and physical disabilities, chronic lung disease, and vision and hearing loss, as well as developmental problems. In addition, for every day that Virginia does not take advantage of this federal funding, we're losing $5 million in tax dollars. That's $5 million a day that could provide health care to mothers and children, $5 million a day that would be invested in preventative care to improve birth outcomes, $5 million a day to invest in our healthcare infrastructure, and $5 million a day to invest in a healthier future for Virginia. So tonight we're asking that you implore your colleagues to expand Medicaid in the state of Virginia, and the March of Dimes has your back in this effort.
Thank you.
Thank you.
Thank you.
Joe Donnelly.
Thank you for allowing me to speak tonight. My name is Joe Donnelly. I'm really speaking as a business person. I serve on the Hampton Roads Board of Directors of the Hampton Roads Chamber of Commerce, the Portsmouth Partnership, and the Hampton Roads Workforce Development Board. Dr. Lee and Mr. Kerner spoke very eloquently about the gap and the need for coverage for the people in that gap. And from a business perspective, I agree that it's good business to cover the people who are in the gap. Most of those people are working people. They are just not eligible for coverage in any other way and can't afford it. The one thing that I would ask you, Senator Lucas, and you, Senator Locke, is to find out a way to meet up with the other side. And I understand that their position is does have merit in some cases. And there ought to, from talking to the people on the other side, from a business perspective, I get the impression that they do want to cover this gap and provide health care coverage for the people in the gap. It's just a matter of schematics, but I don't know all the ins and outs. And the one question that I would have for the Senate is that would it not be, and maybe you can speak to this, would it not be a proper thing to do to take up the House bill and make your changes and send it back to the House and work out the differences and compromise? I am not that knowledgeable about the procedures, but if you get a chance tonight, I hope you would speak to that one thing.
I think we can speak to that right now. As a matter of fact, what the Senate has done, we've offered up 4 different plans to the House, none of which they wanted to consider. And we've asked them to send over a bill that includes Medicaid expansion, and they refused to do it. Now, if anybody else has a different story, you could please tell that one.
And they have no alternative.
Have no alternative. We've offered 4 different plans to the House of Delegates, and they refuse to accept either of them. You have 2 members of the House of Delegates here, so let's hear from them.
Yeah, I'll try not to get into too much inside football of what's happened here. I think the roadblock is one. It is the Senate. The House has standing rules that the budget originates from the Senate. From the House. The House bill was rejected very quickly by Finance and replaced with a Senate bill, and they sent over a Senate bill. I'm not saying whether it was right or wrong, but from a procedural standpoint, that enabled the House leadership not to take the Senate vote on, because if the House bill is amended, the House can do a conference committee. And I think part of the problem or the challenge, and I'll throw it back to the Senate or my other member on appropriations over here, part of the challenge is when you look at the composition of the Appropriations Conference Committee, none of them are supportive of the American Health Care Act. So to have the Senate, and I'm speaking from a procedural standpoint, to have the Senate amend the House bill, the people who support the Affordable Health Care Act are not sure that that conference committee can really compromise if their position is not in favor of it. How can you compromise with people who don't want to go into the meeting with a solid compromise? And I think your comment is very well taken, but I think part of the strategy that I would like to recommend is that we also need to contact the members of the House and see what compromise positions they are willing to take, because other than putting the savings from the Affordable Health Care Act into the budget, the leadership's position has been consistent and overwhelming against the Affordable Health Care Act, and they have not made any movement on that during the whole session.
And I think just to add to that, each time the Senate has sent over a bill, they have suggested that all of the federal money come out of the budget. Well, that federal money has always been a part of the budget. And it is 20% of the state budget, and they know it. 20% of the state budget includes those federal dollars. Senator Locke?
And their own budget includes money from the ACA. So they're saying that we're not going to accept any federal dollars or any money under the Affordable Care Act is ludicrous, because their current bill that they adopted includes ACA funding. So, I mean, and you can't go into a negotiation when one side has already drawn a line in the sand, which is what they've done.
One question that I would say, Joe, you may want to ask is, let's suppose that the Senate is willing to amend the House budget. Suppose. What would they offer as a compromise other than to decouple it and have a special session to that process? And I will use the Transportation Act. We may remember 7 years ago, we had a special session on transportation. And it took us 7 years to get a transportation bill.
And thank you very much for
That's
that.
what happens when you decouple.
But we got the transportation bill. I'm not sure.
7 years later,
Oh, okay.
and a whole lot dollars more.
I don't think we can wait 7 years on it.
Okay. I guess then my question then is, or I guess my observation is, we are then an impasse here in that the Senate is holding the ground on Medicare coverage across the board without any compromise from the House. Is that what I'm hearing?
That is not correct. We've offered the House 4 different options on how to include Medicaid expansion into the budget. And they have refused all of them. They just don't want any Medicaid expansion in Virginia, period.
As part of the budget?
As part of the budget, correct.
Okay. But I
It
do
goes
understand
beyond
from...
just being part of the budget. They don't want Medicaid expansion.
Well, I haven't heard
Period.
that because I know, well, I can't speak for them, and I try to talk to both sides. I have friends on both sides of the aisle, and they, the people who look at it from a business perspective has to realize the impact on Virginians of our tax money being collected and passed to the federal level and not coming back to the state. And most, like the Chamber of Commerce and the other boards that I sat on, we have this discussion, and sometimes we don't take a position on it because there are, like you say, 2 very opposing positions on the Affordable Care Act, and I think that gets in the way. Anyway, I encourage you, thank you for having the meeting tonight and listening to me, and I hope that if there's any way that I can do to help the General Assembly, and I don't know what I could do, but I certainly speak in favor of working out a compromise so that we can get past this. Thank you very much.
Thank you so much.
Jeffrey Charity.
Good evening, honorable senators, delegates, distinguished panelists. Excuse me. My name is Jeff Charity. I am the strategic project manager and assistant to the vice president for the Urban League of Hampton Roads. The Urban League, in conjunction with Celebrate Healthcare and other organizations such as HRCC, Let's Make a Difference Coalition, was tasked with part of the implementation on outreach, education, and enrollment for the Affordable Health Care Act in Hampton Roads. Excuse me. I became a CAC and have personally been witness to helping individuals obtain health care, and I mean, I've helped one couple who was paying $1,000 a month save $800 of that. They obtained a policy through the ACA, to which I got them down to $200. And I am not a person who likes to give up, you know, and to be able to look a person in the face and say that this legislation that was meant to help everybody is not able to help you simply because of a certain criteria that you fall into is disheartening, to say the least. I'd just like to say that the mission of the Urban League is economic parity socially, and I just urge all of you to go back and persuade your colleagues to find a compromise, to be able to vote yes on this legislation so that I can do my job. All right. Thank you very much, and yes on the proposal, please. All right.
We shall try. I am going to call the names of those left on our list tonight, and if you're here, please stand or at least form some position so we'll know where you are. And in this order, we have Angela James. Is Angela James still here? That's the last person from that list. On the second list, we have Donna Sy. Donna's gone. We have Shannon Glover, Herman Weaver, and Richard Phillips. So there are 4 people or 3 people? Herman Weaver, Shannon Glover, and Richard Phillips. Those are the last 3 speakers. Did I say Angela James? She's gone? Okay, all right, so that's correct. 3 speakers.
There's only 2 left.
2 left?
These 2 left.
To this distinguished and honorable panel, I bring you greetings from the Pan-Atlantic Council. We represent 9 professional Greek organizations who are incorporated both nationally and internationally. I was going to ask for my members to stand, but due to the lateness of the hour, they have gone.
I saw about 30 of them leave.
We have a national mandate.
But those who are here can still stand. Members of the Pan-Atlantic Council.
We have a national mandate to support this Medicaid expansion. We represent over 1 million representatives, both national both nationally and internationally. We will be supporting this mandate both in the local, state, and federal representatives. We will be supporting them in the next elections, in the upcoming elections. We hope that our representatives will make a stand on this particular mandate. If we do not, we're going to lose too many of our people. It doesn't matter whether you're red, green, black, or blue. It's going to affect all of us. And we, as an organization, are standing behind only the representatives that will support this mandate. Lastly, I would like for everyone to take a minute to say a silent prayer for our Louise Lucas on the loss of her daughter-in-law. Thank you.
Thank you.
Good evening. My name is Shannon Glover. First of all, I want to thank each of you for taking the time out of your busy schedules to keep this long hours with us. And I just wanted to make a few comments. I am a business owner in the city of Portsmouth. Both my wife and I own businesses here in the city of Portsmouth. I own an employee benefits firm, and I've been involved in healthcare for the last 20 years. I was instrumental in helping start the Medicaid managed care plans through the health insurance companies in the state of Virginia. So I know the benefit of having our Medicaid members managed well and in those preventive care programs to make a difference in their lives. I just want to say one thing. You know, what I heard from a lot of the people that came up here tonight was they want their dignity and humanity. And I don't think that's a lot to ask for. We're all working to have those things in place, and particularly those that are the working poor who cannot afford to pay the premiums that they need to pay to have access to quality health care. The point is this, very simply. I remember in reading in history that there was a group of patriots that fought for the rights because there was taxation without representation. And so, folks, what we're really dealing with here with our legislature's inability to make a decision for what is the right thing to do, those working poor are being taxed. We just heard that dollars are going out of our state to help fund other programs within the United States. They're being taxed without representation. The doctor just said that out of the spending for Medicaid, Virginia ranks 48th. That's shameful. And we ought to let folks know that have a decision in this process that as taxpayers, that as people that are concerned about the health and welfare of our community, we intend to stand with you all. And we want those folks that are currently being taxed to have the proper representation, to give them the proper access to what is the right thing to do. Give them back their dignity and their humanity. Thank you.
This forum has taken 2.5 hours, and I know for some that's taxing, but I think the significance of what it is we're trying to do makes this time well spent. And so with that, I also see our city manager, Mr. John Rowe. I'm sorry I didn't see you earlier, John. And we want to thank you for the use of this chamber this afternoon. And we want to thank all of you for coming. And we want to thank all of you for what you will continue to do to try to help us get Medicaid expansion passed in Virginia. Go out, talk to those legislators who don't understand that exporting our money out of Virginia is not a good idea.
And who were invited here?
Boo.
Thank you so much. It's already so late. Thank you so much. I think it's so worth it. There's so